Health Edge, a possible link between endometriosis and heart disease. This is according to a study just published in an American Heart Association journal.
Dr. Nandi joins us now with details. Doc.
A little scary, because so many women, worry about it. So I think that it's an important study.
So what exactly, for women who don't know, what is endometriosis?
So basically, it's an abnormal growth of uterine tissue that grows outside the uterus. It's a common problem for women, especially during their childbearing years. So lots of women have to face it, so.
Well, the study's sounding alarming, Doc. I mean, should women, what do they do if they have endometriosis?
So the study's saying that there may be a relationship between endometriosis and heart disease. So first thing is lifestyle changes, right, to help prevent heart disease. However, all women should be thinking about heart disease, irrespective if you have endometriosis or not. It's the #1 killer of women in the United States. So to get started early, and here are my prescriptions for what to do to prevent heart disease. #1 is get physical activity. We talk about it all the time. Your body needs to move, and active lifestyle can lower your risk of heart disease and many other health problems. So it can also help boost your mood. Also, eat healthy. You don't need to have a special diet, but eat plenty of fruits, vegetables, whole grains, fish, beans, nuts, lean meats. And if you choose unhealthy foods, remember, it really have a direct impact on your arteries and blood pressure. Also, this is important. Know your numbers. Lots of people don't know what their blood pressure is, cholesterol. Get to know your numbers, whatever age you are. Also know your blood sugar levels, especially if you have a family history, and get tested because they can give important information about your heart and the risk of your heart. So lastly, take care of yourself. Pretty important stuff, basic, but stress, anxiety, depression, lack of sleep have been linked to, guess what, increased risk for heart disease. So make time for yourself, get the amount of sleep that you need. It's very important, 7 to 9 hours a day. And relax or unwind with friends and loved ones. All those, can make a big difference. And I'll tell you one other thing, with endometriosis, we think that the inflammation from endometriosis and sometimes the treatment from endometriosis can actually put them at risk. So, don't just jump right to saying, I want to have my uterus and ovaries taken out, because that may play a role as well.
Yeah, talk to your doctor.
Absolutely.
Now, Dr. Nandi, we do have a viewer question that I want to read, and it's regarding our recent segment on changing weather and health problems. Now, this viewer wants to know if the weather affects people with lupus and fibromyalgia. If so, which states are better for these conditions?
Well, I'm glad they're watching, right? That's right, and then they're asking questions. So two things, fibromyalgia, lots of patients will tell you that the weather affects them. So quick answer is that get to states that are dry. California, Arizona, if Michigan's giving you a problem. Not everybody gets affected with fibromyalgia. Lupus, a little different story. People with lupus have triggers such as sunlight. So if you're in a place like Arizona, you get a lot of sunlight, may not be the best place for you. So lupus patients have to get lots of protection from the sun. So wear glasses, protective clothing, big hats. So very different questions. But I'm glad you asked questions. If you have any questions, Facebook, Twitter, and also website.
Yeah, keep them coming, and we'll get the questions right to you, Doc.
Yeah, I appreciate it.
All right. Thanks so much.